All right. Thank you, everybody, for being here today. We're going to have a press conference inside today because it's a little cold outside, and the signers have a hard time working in the cold. What we're probably going to do next week is move the press conference to Faneuil Hall for better acoustics, if you will. So we can do physical distancing, obviously, inside there. So we'll let you know as we move towards next week. I want to start today with the COVID numbers as of yesterday. The state numbers: new confirmed cases, 5,675 cases. There were 89 new deaths reported yesterday, bringing the total death total in Massachusetts from February to 10,922. In Boston, we had 394 new confirmed cases, bringing our total confirmed cases in the city of Boston to 31,086. We had 7 deaths recorded yesterday, bringing our deaths since the beginning of the pandemic in Boston to 947. And for all the folks that are still suffering from COVID-19, and I want to say you're in our thoughts and prayers, and for the families who lost loved ones, we constantly think about you, and during these difficult times, want you to know that you're in our thoughts and prayers as well. Testing data for the week ending December 3rd, we had an average of 5,437 people tested each day. That's up significantly from the previous week. That's up 16%. That does not include college testing. So as you see these increased numbers, we're not inflating the numbers by putting the college testing in there. We do have, I don't have them on me here, but we do have college testing for anyone interested in seeing what those numbers are. The average number of positive tests for each day in Boston were 408. That's up from the week before. Our current community positive rate is 6.9%. That is up from previous week, 4%. Dorchester, East Boston, Hyde Park remain the neighborhoods with the highest positivity rate that we're seeing here. Our case numbers certainly are very concerning, as I said now for the last couple of weeks. Our hospital numbers have ticked up upwards, but at a very slower rate. We are staying closely connected with our hospitals to understand what they're seeing and how we can support them. I actually had a call with our hospitals on Monday to talk about what they're seeing now as compared to what they saw in the height of the COVID surge we had. The biggest thing is they're not seeing the same hospitalization utilization. They are still bringing patients in for elective procedures. I know the governor put some restrictions on the other day, but they want to be able to continue to be able to take care of sick people and continue to screen for cancer and things like that. So, but we're going to monitor the situation very closely with them. If need be, if we have to restrict some of that, those procedures in the hospital, we will obviously let everyone know. But right now, we do not today. We need to continue to stay focused and vigilant. I want to thank everyone who's doing their part. The city is going to continue to provide information and supporting people as we continue to move forward here. And any information that needs to be known, we're going to get it through the press. We're going to get it out through our texting messages. We're going to get it through our social media outlets. We're going to be getting any information out there to all the folks. We're also continuing taking a very cautious approach to reopening. The other day, the governor moved back to Phase 3, Step 1. Boston did not go to Phase 3, Step 2, so the rollbacks really didn't impact the city of Boston. There was really no rollbacks here in Boston to say of that we had to do because we hadn't gone that far along. And we have stayed there for quite some time. We're determined that it wasn't the right move for us to move into Step 3, Phase 3, Step 2 at the time. We've taken a pretty conservative approach in some cases to reopening all along. We're going to continue to do that. Our goal is to get these numbers down so when we do reopen something, we don't have to pull back on reopening. And that's really something that is important for us. Public health continues to be and will always be our #1 priority. The city of Boston continues to monitor the data very closely in every scenario, whether it's daily tests, whether it's 7-day averages, percentages, actual test numbers, hospitalizations. We're looking at all these different areas just to make sure that we have the right metrics so we can make the right decisions to keep the people of Boston safe as we continue down the road of hopefully reopening more and more. We're looking at the best ways to reduce size and gathering while maintaining essential service programs. We're developing plans on how we can tighten restrictions in Boston if necessary. And we don't want to get caught by surprise, as you know, and the people watching at home. These numbers change literally daily, and that's why we do the 7-day average, so you can see how drastic in some cases these numbers can either go up or go down. So, for example, in the positive tests from last week to this week, from 4% to 6.1%, so you can see those numbers fluctuate pretty quickly in a 7-day span. Boston and myself personally continues to be in regular conversation with the governor and mayors from across the greater Boston region. We're on 2 calls this week so far. We have another one tomorrow night. They're really just calls talking about what we're seeing, the trends we're seeing in our different neighborhoods, and what we're doing in different places and ideas we might have as far as moving forward. Some cities and towns are seeing numbers increase like ours, and some aren't in the Boston area, greater Boston area. So we're going to continue to stay close with our colleagues. We want to continue to support one another's efforts, sharing best practices when possible, and also we have in the past shared our resources as well with other cities and towns that need help. We need to make sure that we continue to work together as a region. That's really important in order to help slow the spread of the virus and protect all of our residents. The vaccine distribution. Yesterday, the governor announced that the first round of COVID-19 vaccine shipments are set to arrive in Massachusetts around December 15th, which is next week. We are committed to doing our part to make sure the vaccines get distributed equitably and efficiently throughout the city of Boston. The state has said that the vaccines will be available free of charge to individuals, which is something I was concerned about several months ago, so it was great to see that yesterday, hear that yesterday. The Boston Public Health Commission and Chief Martinez here with us today is working with our hospitals, our health centers, our long-term care facilities to plan and support all the different stages of distribution. In the meantime, we are already understand the outcome, hesitating to take the vaccine. We're sharing the facts about why taking the vaccine is the right thing to do for yourself, your family, and your community. As always, we want to make sure that the decisions that you make are guided by equity, prioritized by what you feel is right. We also want to make sure that as the vaccine comes out, we're going to be taking care of our vulnerable populations, all of the folks that need to make sure that we get vaccinated if they choose to, that we can get them vaccinated. News about the vaccine has been certainly a beacon of hope in what a lot of people perceive as a very dark year. We are grateful to all the scientists, the medical professionals who have worked tirelessly and continue to work tirelessly to make it happen, including many people here in the Boston area. It's just a reminder of how much talent really exists in our communities and how when we work together, we can develop solutions even for the biggest problems. But I want to remind people the vaccines will take months to roll out to everybody. We cannot let our guard down, not even a little bit right now. We need to remain vigilant, wearing masks, washing hands, cleaning down frequently touched surfaces, avoiding large crowds. If you have that's really important to do. I can't stress that enough. As we see these numbers, these masks really make a big difference in stopping the spread of the virus. As far as testing, if you have a reason to think that you've been exposed to COVID-19, we're suggesting and asking you should get tested. If you've traveled for the holidays or in gatherings larger than your household, we're suggesting and I'm recommending you get tested. We have over 30 test sites here in the city of Boston. We continue to expand testing, especially for communities with the highest rates of infection. This week, our mobile testing sites are available at the Anna M. Cole Center in Jamaica Plain through the end of the day today through December 10th. I said that completely wrong. It's available through Thursday, December 10th, which is today. So we want to make sure that you can get tested. It's available also at the Washington Park Mall in Roxbury, Central Square Park in East Boston through Saturday, December 12th. We will be announcing next week more testing, where those testing locations will be. Next week, we're going to introduce a new indoor drive-through mobile testing site in Hyde Park. This site will have a large testing capacity of 500 per day to serve even more people. It will be open on Tuesday, December 15th. This is in partnership with the East Boston Health Center. We're going to continue working to ensure residents have access to indoor mobile testing during the winter months. It's basically a warehouse that's been set up, that's there. We're going to use the warehouse to have people drive through and get tested. For more information about our testing and data sites. Go to boston.gov/coronavirus, or you can simply call 311. I want to update everyone on Boston Public Schools. We're doing everything that we can to protect public health while maintaining essential services here in Boston. At the top of that list is certainly educating our young people. Right now, those students with the highest needs. Currently, we have a small number of students with complex disabilities, and they're learning in person in 4 of our schools in Boston. Those schools are the Carter School, the Henderson School, the Horace Mann School for the Deaf and Hard of Hearing, and the McKinley School. Beginning Monday, the 14th, which is coming Monday, an additional 28 schools will open to provide in-person learning opportunities for approximately 1,700 kids. These students with complex disabilities and language needs who we have identified as high needs priority in-person learning. We have communicated directly with the families in collaboration with their school leaders and outline what the next steps are. These plans for schools are based on the number of families of students with high needs who've selected hybrid learning. So again, these students are not being forced into school. These are all students and families that have opted to do in-person learning. They focus on each of the buildings' ability to safely welcome students back and staff back in person. On Tuesday of this week, the school department reached out to the Boston Public School families. We laid out a plan. We explained to the families the additional safety measures that we're taking in our schools. We are upgrading our filter system. We have done that, and we're going to continue to do that in our buildings. We also have freestanding air purifiers in buildings that don't have HVAC systems. We've received 5,000 air purifiers through a partnership with DESE, and we have ordered additional units from vendors to get them here. So as we think about school in January and February, we'll have more air purifiers in our schools. All 28 schools that will be opening next week have air purifiers delivered for placement in instructional spaces. We're also delivering medical-graded PPE to all of the schools for our nurses and nurses' office in those schools. We're working on testing of air quality. We're going to continue to test air quality in the schools. We're making sure each of the schools can follow the safe distancing guidelines, so we'll not be having groups of kids together. We're also working to increase testing access for all teachers and essential workers. In the 4 schools that we opened earlier in the month, we have unique testing facilities for those, and we're going to be creating opportunities for these other 28 schools for teachers to be able to test it in and around the neighborhood. The health and well-being of our young people needs to continue to be our #1 focus. Health experts are clear about getting students back into school, particularly high-need students, is a top priority and should be a top priority. We obviously have to balance the needs of COVID safety with the duty to educate high-need students. Those students include disabilities and language supports, which can only be met in person. And many of these families have been struggling to try and get services for their kids. This has been a challenging time for them. It's been a challenging time for other folks. And our intention now is to make sure that we get these students back into school. Those needs also include safety around trauma, mental health services, and social emotional development. For many students, school is the only safety. We'll continue to do everything we can to bring students back as soon as we can do so. Plans continue for the next group of students to return, and we'll release a timeline for reopening school buildings in early 2021. The dates are going to really depend upon where we are in the coronavirus cases, what the daily test cases are, what the average weekly rate is, and also accessibility to other options that we can move forward. Outdoor dining, 2020 outdoor dining has been obviously very hard for our restaurants. Many of you, the news channels, have run stories on just the devastation that our restaurants have faced. Last week marked the end of the 2020 outdoor dining pilot program. It was a team effort that helped protect public health while helping small businesses try and survive. For the 2020 outdoor dining season, we approved more than 550 requests for outdoor dining licenses, with 415 on public property. Restaurants in every single neighborhood and cities in our city was represented. Our Disability Commission distributed over 90 portable ramps to restaurants at no cost so that people could have access to all of the restaurants. We saw the benefits of outdoor dining can have in our neighborhoods, bringing vibrant streets to our community and fun experiences for restaurant goers. I want to thank all of the city staff. I want to thank the restaurant staff, all the local business owners who made this program what I think was a success. I'm also proud to announce that outdoor dining pilot program for the 2021 season. The 2021 pilot program will begin on April 1st and end on December 1st, 2021, weather permitting. Restaurants who took part in the 2020 program must reapply for 2021. We'll also be accepting applications from restaurants who did not take part in, that want to take part in the pilot program that's going to start in April. We will have more accessible ramps available for restaurants. Restaurants can start applying now by visiting boston.gov/2021 outdoor dining. We're making some changes from the 2020 program experience based on feedback that we've heard from community and from our small business owners. We are moving the application process to a different online platform where we can track the status of applications and you can track your status. We're building more time into the process. We're providing clearer guidance and guidelines. It will be available in both English and Spanish and other languages upon request. All of the guidance, you can go to the same website, boston.gov/2021 outdoor dining. We're also offering free one-on-one help for restaurant owners who require support, whether it's on an application or translation. Many restaurants, it's the owner's the cook, and does it all. So if you need help, you just contact the City of Boston. We're there to help you. Starting next week, we're going to be hosting virtual help sessions for restaurants who want to apply. The first session is scheduled for Wednesday, December 16th at 5 p.m. Registration is required. Again, for all information on restaurants, go to boston.gov/2021 outdoor dining. We're almost done here, and I'll take some questions. One of the things that I think is really important for us as well is safety during the holiday season. I want to talk about the holidays. Many of us are starting to make plans for what is obviously going to be a very different holiday season this year. This is usually the time for traditions, gathering with family and friends, office parties. I know many people will be hoping for some normalcy right now. But this isn't the year. This isn't a normal year, and this is not the time for us to start thinking about going back to normalcy. This holiday season has a very different look and has a very different feel. That means continuing to follow the public health precautions, limiting gatherings to only people who are in your households. Since Thanksgiving, we've seen, and there was talk about Thanksgiving, we've seen a significant spike in coronavirus cases and hospitalizations. We've seen that in Boston. But if you look around the country, some of the hospitals have been devastated by the spike from Thanksgiving. A big source of this transmission is coming from indoor private gatherings. This is something that we can all avoid, and the responsibility sits on all of our shoulders. So like we did before Thanksgiving, we're urging everyone to celebrate with the people they live with. There should be no holiday parties. As hard as that sounds, I don't want to sound like somebody that's doom and gloom, but it really is important for us as we think about going into these winter months. We are strongly encouraging Boston residents not to travel. Travel increases the chance of getting COVID-19 and spreading COVID-19. I know that everyone is tired of living with this virus. But this is not time to let our guard down. The stakes right now are just too high. I also know it's hard to say no to loved ones. Many of us have been having difficult conversations with our family members about what to expect this year, including myself. But just because we can't get together in person doesn't mean that you can't come together in other ways. We're asking you to consider other ways of getting together virtually. This is a time to be creative. Keep the holiday spirit alive. Over the next few weeks, we're going to continue to remind people and everyone about the importance of staying safe throughout the holiday seasons. We're also going to remind everyone about families who are struggling to make ends meet. The needs of our community this year seem and are greater than ever, and collecting toys will be a challenge for families who can't afford it. At the last press conference, we had Toys for Tots with us. Toys for Tots donation boxes will be here at City Hall, at our firehouses across the City of Boston, at our standalone BCF centers, and at the City of Boston Credit Union locations. I'm asking people that have the means and the ability to do that when you're out there shopping, if you would consider buying additional toys and dropping them off at the Toys for Tots locations so they can hit their goal. I want to make sure that every family in the city of Boston has some joy this holiday season. We need to continue to do everything we can to help them. And I also want to thank the press. I know that you will do stories probably on Toys for Tots and other organizations looking for help. I want to thank you and encourage you to maybe do more this year if you can, because the need is greater. This holiday season is going to be something like we've never experienced. But we can keep in mind the spirit of the season in a positive manner. So we're asking everyone to make your holiday plans now and make sure that you continue to keep your safety, your health at top of mind. We are in certainly this battle together, and if we do our part protecting one another, we can spend more time in the holidays next year. We can get out of where we are, coronavirus. With that, I'd like to open up for questions. Shauna? The question is, do I think that the state went far enough in the rollback's coming up, and is the city of Boston considering further rollbacks? I think that the state rollback, it works for some places and doesn't necessarily work for other places. I think you look in different places, you've seen spikes. I can tell you what we're doing in Boston. We are looking at our list right now, and in the event that we need to roll back, we don't have to today. But in the event we need to roll back, we will not hesitate and roll services back. And we're actually, Marty Martinez and our team was meeting earlier today. They're going to be briefing me later on some of the recommendations of what a potential rollback would look like. Again, we're not rolling back right now. But as I said earlier, this virus literally changes from week to week. And I could be standing here next Tuesday and having a very different conversation with everyone. Our goal would not to be rolled back. Our goal would not to be roll back restaurants. Our goal would not to be roll back movie theaters. Not to roll back what's in phase 3, step 1, or go back to phase 2, step 2. That would not be my intention to want to do. But if the numbers continue to go up, if our hospitalizations continue, if our ICUs get over capacity, we want to catch it before they get over capacity. So it's on the table. I'll come. I have not had that conversation. I don't know. No, we haven't had that conversation yet, but we will be. We certainly are working now to create an infrastructure for vaccine distribution and what the guidelines will be from CDC, who the highest priorities are first, and then rolling that out. So we don't have the number, but I'm anticipating that by obviously as we get through the winter and the spring, we will have enough vaccine for everyone. But that's just because there's so much potentially available. But I'll be able to get more information on vaccines as we move forward.
Mayor, really brainstorming to figure out what to do differently going into Thanksgiving to prevent the numbers that we had going into Christmas. Is there anything we can do differently to prevent what came out of Thanksgiving?
The question is, have we thought about doing anything differently? What we learned from Thanksgiving going into Christmas, and how can we move forward? It really is, short of shutting everything down, it's really within each individual person's power to, when we talk about wearing masks, masks are working. The experts tell you it works. The scientists tell us it works. It's not 100%, but it reduces your potential risk of spreading or catching the virus. Washing hands is 100% foolproof. Washing hands often with soap and warm water, cleaning down frequently touched surfaces is really important. House gatherings, I understand the want to get people together, and sometimes you think that I'll only bring over a couple couples and we'll have dinner or what have you at your house, but you have no idea where they've been. You have no idea who they've been in contact with. So when you're bringing somebody who's a friend or a family member in your house who you're not used to seeing, you're potentially bringing the virus into your house. And by doing that, that's where we're seeing the biggest spread. And we're asking people this year that can't happen. You shouldn't do that. Again, it's about protecting you. Now, some people will argue, and I have friends that will argue, well, the people getting the virus are under the age of 39, and they're not being hospitalized, and they're not dying, and that's true. But the concern is, their friends under 39 that have the virus, if you go visit an elderly grandparent and you pass the virus on to your grandparent, well, your grandparent ends up in the hospital. So it really is about protecting you and your family. All I can say is we saw the numbers show with the increase in travel and the increase of gatherings during the Thanksgiving season, we saw an increase of COVID cases. With that increase of COVID cases, we've seen an uptick in hospitalization. So there's no question that additional travel and additional gatherings equals additional hospitalization and higher COVID cases. What we don't want to see is our hospitals overburdened. Yeah, people saying shut it all down. Some people saying don't shut it all down. I mean, I think that, again, we're watching, you know, I've been very conservative on this. I've been taking very aggressive steps from the very beginning of this. If we feel we need to shut it down, we will shut it down. I'll get to everyone.
There was a protest out here from parents saying, let's at least get the elementary schools open. I know you're moving now with special needs and kids that really need in-person learning the most. Have you considered moving toward elementary schools as well?
Yeah, we're going to be laying out in the course of the next couple of weeks our hopeful plan to start school in January and getting our kindergartners through 12th grade into school. Yeah, there was a demonstration outside here, and I appreciate people coming in demonstrating, but it's not as simple as just opening up the schools. It's also making sure we have all the safety protocol in place, making sure we have the teachers that will come in. I mean, some of our teachers are concerned about their own health. Some of our teachers have pre-existing conditions, so we also have to be very careful and cautious about when we open up our schools. So our goal was to be open by now. I mean, right now, our goal back in September was to have any student that opted in, any parent that opted in, to be in-person learning right now, and unfortunately the higher rates of the virus prevent that from happening.
Would you phase it in though with elementary first, because those kids are at low risk?
Yeah, well, this would be the phase, this would be the approach. It would be highest needs first, which we're doing now. Then the next phase would be K0 to K2. The next phase would be grades 1 to 3. 4 to 8, and then high school. That's how the phases went last time.
Would that happen here? And if it did, are you concerned that would scare some people away?
Yeah. Great question. The question is, the federal government is looking for identification to get vaccinated. I think we should vaccinate everyone in the United States of America, whether they're a citizen, whether they're undocumented. It's about spreading the virus. I mean, that's ludicrous to say that we shouldn't. If you don't have an ID, you can't get a vaccine, because you're not protecting everyone by doing that. So I probably expect that to change on January 21st. Oh yeah, I'm very concerned about the fact, polling. There's been some polling done nationally and some polling done locally of communities of color, particularly Black community, Latino community, immigrant community, that people are worried about the vaccine. So we do have some work to do to be able to explain to people the importance of taking the vaccine.
Is there a number you can hang on Thanksgiving-related cases in the city of Boston? Do you have a number?
As far as
Thanksgiving-related COVID cases?
I would. No, I can't say that we're seeing the spike because of Thanksgiving, but you don't have to make an assumption. You can if you look at the trends. Let me go back 3 weeks. Sean reported on. He asked me a question about. We've had 2 weeks of moving down on our numbers. As we head into Thanksgiving week, our numbers were trending down in the right direction. Right after Thanksgiving, literally 5 days after Thanksgiving, we saw the first 500 case day since June. We had 7 consecutive days of over 500 cases of coronavirus, meaning people testing positive coronavirus. Our rate went up over 2 percentage points. So there's definitely a connection there. And now we're seeing, 10, 14 days after Thanksgiving, or 10 days after Thanksgiving, we're starting to see that number go down again. So there's definitely a connection to travel.
Any indication of what the ICU capacity in the city is right now? And is it at a level the city is comfortable?
We're still at a safe level. I'm going to ask Marty Martinez to come up and talk a little bit about that, more technical about the hospital. I don't want to give the wrong information.
Thanks, Mayor. The question's about the ICU capacity. So just briefly, we are monitoring 3 metrics in the hospital. We're monitoring emergency department visits of COVID positive folks. We're monitoring the capacity of the ICU and also the availability of medical and surgical beds. So right now in Boston, the 7-day average of capacity in the ICU usage is about 90%. And that's higher than it's been for quite some time. We had seen it a very low number at some point. I think we have roughly 100 plus patients in the Boston hospitals that are COVID positive. So it's increased. These are just beds, non-surge beds. These are regular beds in the ICU. We don't want to see it that high. We want to see it lower. But our hospitals are managing that. They're making sure to do their very best to see and transfer people out of the ICU if they can, if they're well enough, and they're balancing that out.
Is that at a level where you start to talk about and think about reopening a field hospital in the city? Is it going to be there yet?
Yeah, no, so to give you a sense of that, across Boston hospitals right now, we have about 300 COVID positive patients. In April, when we had the field hospital, we had about 1,600, right? So our number of total patients is much lower in our Boston hospitals. It doesn't mean we want to keep seeing it climb, right? I mean, it was very low just about maybe 6 weeks ago. That number was much lower than 300. So as it continues to climb, we monitor that. We're actually talking with the hospitals 3 times a week in terms of their emergency departments and what they're seeing in terms of emergency planning. So we're going to continue to monitor that and make sure they have the capacity to take care of everyone that has a severe impact. I think I've said this multiple times. As we live with COVID, we have to make sure our hospitals can take care of people, and right now they can.
On the metrics, this is a metric-specific question. I noticed in the data that was released yesterday, neighborhood-specific data, East Boston, for the weekly positivity rate at 26% positivity rate. I'm just curious if that's the metric the city has been using for months, and if so, is that the highest rate for any neighborhood during the pandemic?
Yeah, so the question's about the East Boston positivity rate that you asked. The rate that's being referenced is really the cumulative rate. That is one person's test being counted one time. The positivity that we're looking at by neighborhoods is a 7-day average, a 7-day rate. So it takes all the people who've been tested in that neighborhood over 7 days, and it divides them by the number of folks who had tested positive. So the rate in East Boston is over the city average. It has been continuously. I think it's 9% right now, and we're concerned about that. And it continues to be a neighborhood, East Boston, Dorchester, and Hyde Park, where we see higher than citywide averages. But the rate that you're referring to, that really only counts individuals one time. And what we really want to do is look at, for 7 days, the total number of people tested in that neighborhood, what percentage of those people tested positive. That gives us a better indication of current positivity in the community.
I think that the state's still working all of that out. I mean, I've talked to the governor about this. The one thing that, oftentimes we sit up here and beat up the federal government. The one thing the federal government does really strongly is distribute vaccines. So we are working with them, and we're still working on the logistics of how it goes into hospitals, health centers, and how it gets out to the greater community. Let me go, Sean. I'll come back to you, Sean. Say again, I'm trying. Sorry.
So a month ago, you put out these thresholds for concern for each of the coronavirus metrics. We've now crossed 3 of those.
We haven't hit the hospitalization one. So the hospitalization one is the 3 that we're concerned about.
Percent positive. So you already positive the neighborhood by neighborhood and the number of positive tests.
Yeah.
So that's hurt.
No, there's no question about it. I'm not downplaying the virus here, but the one of the biggest metrics that I'm looking at, and we look at as far as pulling back, what Shaman asked earlier, really is about hospitalization. It's about capacity. It's all of the numbers, obviously, and we're monitoring. The people that are getting sick. Who are they? Lots of the people that are getting sick right now are under the age of 39. We know that they're coming from house parties or gatherings, and they're not being treated in the hospital. They're being treated at home. and they're on whatever the protocol is for when you get COVID, but they haven't elevated where they need a ventilator or go to the hospital. That's where the concern comes into play when you think about shutting businesses down. And obviously, I guess the argument will be, well, you know, what they've done in some European countries and cities is shut down for 2 or 3 weeks, the whole country, everything. They have a different system over there. When people get shut down, sent home, they're paying for them not to work. They're helping their businesses and paying for their businesses, so the businesses don't go out of business. That doesn't happen here in the United States of America. So we have a different economic structure as well. And so when we think about make these decisions, a lot of it's based on all of that. In a perfect world, we would. I mean, everything gets shut down for 3 weeks in the world, and we could combat the virus back. But unfortunately, we don't have the ability to do that.
You mentioned that she's going to be giving recommendations later about possible restrictions.
Yeah, possible. If we have to roll back, what those rollbacks would be. So, for example, when you think about rolling things back, when I'm thinking about rolling things back now, I'm looking at, do we just go back in steps? Or do we go back, or the steps that were the reopening steps at the state, or do we just roll certain industry back? And how does that look? And what's the impact of rolling back? I mean, you can roll back, but you want to. The intention behind rolling back is stopping activity, and stopping activity that would cause a spread. And I think that, you know, in the next phase, phase 3, step 1, phase 3, step 1, which is where we are today. There's lots of activities in that people are gathering on, and we're going to go through to see if we do have to roll back, what would those be? No, because I'm not speculating right now, so it'll be a story on the speculation of what we're rolling back. Yeah, first and foremost, thank you for bringing that up. Suffolk Superior Court ruled in favor of the city of Boston the other day to allow us to move forward in building a bridge to Long Island. Quincy, I read in the paper today, said that the fight's not over. This isn't a fight we should be having. Long Island is owned by the city of Boston. Long Island, from the 1950s through 2014, we had a bridge that went out to Long Island. On that island, it's been historically used for social services. Our homeless were on that island previous to 2014 when we had to shut the bridge down. We moved the homeless shelter in town. I want to build a recovery campus on Long Island. We have a substance use disorder issue in the United States of America that is pretty big. The intention that we want to build a bridge back is to build a recovery campus that doesn't exist anywhere in the United States of America right now, and we want to create something special on the island that people that are struggling with substance use disorder, whether it's drugs or alcohol, they have a place to go. I'm not building development on there. I'm not building a casino on there. I'm not building condominiums on there. I'm building a recovery campus, and the recovery campus will be open for anyone that wants to use it. It can be from Quincy, can be from Weymouth, can be from wherever. Can Boston, obviously. And the fact that we're in a global pandemic and we're seeing so much devastation, the fact that we still are fighting and spending money in court and stopping us from building a bridge and not taking a step back to listen to what we want to do is really disappointing. And I have not gone. The mayor of Quincy is a friend of mine. I respect the elected officials in Quincy, but this is just simply wrong. This is just wrong, because anybody in the city of Quincy, any family member that has a problem with someone in their family with whether it's drugs or alcohol, our arms are open in the city of Boston and welcome them to any treatment facility, any halfway house, anything that we have in the city of Boston. I would say let's try and help everybody. And the fact that response was that way is disappointing. I'm excited. that a Superior Court judge rules in favor of the city of Boston. Our goal is to move forward. Our goal is going to be to build that bridge. Our goal is going to be to build that campus. Our goal is going to open that bridge someday, cut the ribbon on that bridge, and open the doors to the recovery campus. And if the first person in line is from the city of Quincy or the first person in line is from Squantum, they are more than welcome to come in. No, we're trying to wait and see what the reaction now of, unfortunately, when you talk about courts and appeals and further appeals, it's kind of one of those things. So we'll see what happens.
The city council passed an ordinance that would be a special commission to end homelessness. Do you plan on signing off on that ordinance?
Yeah, no, we've done a lot of work already. We during the pandemic, we've been able to distribute over 1,000 vouchers to BPS families. I'm working closely with City Councilor Nisa Sabi George on that. The purview of family homelessness is at the state, but we have been able to, we're jumping more and more into this conversation now as a city to offer supports. We've been building housing units for families that are homeless. We've been working with trying to get families out of shelter. Some of our eviction moratorium that we're fighting for to extend is to prevent further family homelessness. So I've been working. There's nothing to sign. I've been in this issue since I got elected in 1997.
But the ordinance setting up the commission, did you?
Oh yeah, absolutely. Yeah, I'm reviewing that. Council did a vote yesterday, and they did an amendment to it as well. So I'm going to review it and have some conversations. All right, everyone. Thank you.